Yeah, good afternoon, madam.
Hello, sir. Good afternoon.
Yes. After class, you may start the class, madam, please.
Okay, sure. Thank you, sir.
Yeah, thank you.
Yeah, good afternoon, everyone. So, can we start with the class? Any doubts in any of the previous sections you may ask? Anything you want to ask from the previous section, or I can start with the next unit?
Madam, I think to start the new session.
You can start.
Okay, sure. Okay, so let me share my screen and I'll start with the next block. So we will be starting with the last block for CNCC01, that is block number 6. Now in this block, you have different chapters which are related to, different nutrient deficiency control program and supplementary feeding programs. So, in earlier of the sections, we discussed about different nutrient deficiencies which are prominent across, different populations. So we learned about vitamin A deficiency or, deficiency of iron which causes anemia and so on. So particularly in the Indian settings, we have different programs which are designed to combat or to lower the prevalence of these nutrient deficiencies. So unit 6 will deal with some of these programs and also supplementary feeding programs. And lastly, you have unit on assessment of nutritional status, because I think that assessment of nutritional status requires a little more attention. So I will be starting with unit 25 first. Is this fine with all? Okay, so I would be starting with unit number 25. That is the last unit. So let me go there and I'll just, okay. Now, just give me a second. Yeah, this one. So is my screen visible? I hope my screen is visible to all of you. Okay, so when we talk about nutritional status, okay, so firstly we need to understand here that what are the different methods by which actually we are going to assess nutritional status of anyone. So you may want to assess the nutritional status of a 5-year-old child or a newborn or some old person or adult, adolescents, whatever, right? So now why it is important for us to deal with assessment of nutritional status is because we know that nutritional status is actually the state of health. Okay, so if I present you a child who is 4-year old, okay, so maybe this child is 4-year old and I am asking you that what is the nutritional status of this child. Okay, so you might be saying that the nutritional status of child is good, poor, or bad. Based on what? You will be looking into factors like what is the age of the child, and according to that age, what is the weight of the child, or what is the height of the child, and so on. Okay, so let's say for example, if this child is 4-year-old or 3-year-old and his or her weight should be say 12 kgs, just an example, okay, and this child weighs only 7 kgs. So now we can understand that ideally this child should be weighing what, maybe 12 kgs, but at present this child is weighing only 7 or 8 kgs. So this shows that this child is having poor nutritional status. Okay, because what is nutritional status? Nutritional status refers to state of health. What is the present state of your health? Okay, and how this is influenced, this will be affected by your intake, what type of nutrient, what type of nourishment, what type of diet you are having, and also that how these nutrients are utilized. Okay, so when we did a chapter on anemia, which was because of iron deficiency, we learned that sometimes it is not the intake which is problem. Okay, so it is possible that my intake of iron is normal, but the problem lies with utilization, how or how much my body is absorbing it. So in that case, we say that nutritional status is what is this? It is the state of health. And how this is influenced? This state of health is affected by two things. We have intake and also the utilization. So just, taking the example of this child again, who is maybe 4-year old, right? So we say that this child has a poor nutritional status, because according to age of the child, this child should weigh maybe whatever kilograms, but presently this child is weighing less than what is desired. Now, when we say that how we are going to do assessment, so this was just one example, wherein I just discussed that you can assess, age of the child, and according to age, you can weigh the child. But usually, whenever we say that what are the different methods of nutritional assessment, the easiest way to remember these methods are what? A, B, C, and D. Okay, so always remember that there are four major methods which are used to assess the nutritional status across any population. So it might be a child or an adolescent girl, or pregnant women, or whosoever. So whenever we say that we want to assess the nutritional status, supposedly you want to assess your own nutritional status, okay? So what are the four methods you will be utilizing? The four methods to assess nutritional status are, remember by the name, A, B, C, and D. Okay. How A, B, C, D? Because the initials A, B, C, and D. So A stands for anthropometry, B stands for biochemical, C stands for clinical, and D stands for diet. And this is an important question from your examination point of view also. So whenever anyone asks you that how you are going to assess the nutritional status of anyone, the best way is what? Doing the ABCD analysis. A is anthropometry, B is biochemical, C is clinical, and D is dietary. And one by one, we are going to, discuss about these methods, like what they are, how you are going to do it, and what are, different advantages and disadvantages related to the same. So up till here, is this clear to all of you? Can I move ahead? You can write in the chat box if this is clear, or if you have any question, you can please raise your hand. Is this clear?
Please, Ma, can you repeat the A, B, C, D?
A, B, C, D. Yeah. So A stands for anthropometry. Okay. And I'll explain these to you. Okay. So A is anthropometry. I'm writing in the chat box also. B is biochemical. C is clinical. Okay. And D stands for dietary survey. Now, is this clear? So what are the four methods of nutritional assessment? By these four methods, that is ABCD, anthropometry, biochemical, clinical, and diet, you can assess the nutritional status of anyone. Okay. Now, it is totally dependent on you whether you want to use any one of these. Okay. So according to, my feasibility, my ease, or, my population, I am using only anthropometry, or I am using all four of them, or I'm using the combination of these. So out of these four methods, it is totally dependent on you what method you want to use. You want to use any one of these, all of these, or combination. But the simplest way to remember is ABCD analysis. Now I will be discussing these particular methods one by one. Okay. So first one is what? Anthropometry. Always remember, anthropometry means measurements, right? So whenever I am talking about anthropometry, what do I mean? That you are simply measuring your body size, and this body size can be in terms of your weight, in terms of your height, and other, circumferences. So always remember, when you are measuring your body size, your body dimension, physical measurements of different parameters of your body, that is related to what? Anthropometry. So whenever I'm saying that I need to weigh the child, I need to see that what is the height of this child, or in case of very small babies, infants, we also measure, circumferences like head circumference, chest circumference. In case of adults, now we have waist circumference or hip circumference. So all these, bodily measures, physical measurement of your body circumferences, is what is known as to be anthropometry. Is anthropometry clear to all of you? What is anthropometry? Clear to everyone? So this is what? This is taking physical dimensions of your body, and this is referred to what? Anthropometry. Okay. Now, when I talk about anthropometry, you can take height, weight, whatever you want to take. But the most, frequently used or most commonly used body measurements which will serve a good indicator of nutritional status are these four. Can you see all these four? So you have weight for age, height for age, arm circumference for age, and weight for height. Okay, particularly in case of children. Okay, these four are very good anthropometric measures which will help you in identifying and assessing the nutritional status of children. Okay, so these four are what? Weight for age. So as the name suggests, it is what? That according to the age, what should be the weight of the child. Then you have what? Height for age. Height for age is what? At that particular age, the height of the child should be this much centimeters. Then you have what? Arm circumference for age. Arm circumference is usually refer to mid upper arm circumference, and this is usually done, this is the specific measurement which is done up till the age of 5 years. Okay, but if you are taking arm circumference for age, it refers to the midpoint of elbow point and shoulder point. So it is not that somewhere around the arm you are going to take the measurement and you will be assessing. No, arm circumference, the correct point for taking arm circumference is what? When you take exactly the midpoint of the elbow point and the shoulder point. So whenever you measure what? That where is the shoulder point of the child, where is the elbow point, and just at the mid of that you will be taking the circumference. So if it comes 11 centimeters, 12 centimeters, so that will be the arm circumference. Then finally you have what? You have weight for height. Now you see, this first one was weight for age. So this was what? This was related to that at particular age what should be the weight. But the last one is what? Weight for height. So this parameter indicates what? That according to that height, what should be the weight. Is this clear, class? So in anthropometry, by anthropometry we mean taking body measurements. So you are taking height, weight, circumferences, etc. So all these physical parameters, physical dimensions you are taking, that is a part of what? That is part of anthropometry. And the four most commonly used measures which help in assessing the nutritional status, particularly in case of children and also adults, are related to what? Weight for age, height for age, arm circumference for age, and weight for height. Is this clear up till now? Any questions? Anything you want me to repeat?
Excuse me, madam, you can increase on your letters. The slide is not clear for me.
I have already zoomed in. Okay, if this is clear to you now, I have increased the font. Now you can see that?
Yes, yeah, I can see now.
Okay, so I have increased the font. Okay, so these four are the basic anthropometric measures. Now, why is there need, or why do we say that these four indicators are useful? Okay, because see, whenever we talk about weight for age, right? So that means what? That at this particular age, the child weight should be this. At this particular age, the height of the child should be this, right? Now, it is very important, firstly, to correctly note down the age of the child. Okay, so it is very important to accurately do the age assessment. In most of the populations, obviously, we have birth charts, we have, birth certificates on which the, date of the birth of the child is clearly mentioned. But, in certain rural areas, or people or communities which are not very well educated, or which are not very well aware, so in that case, particularly in Indian settings, in the rural areas, you have to correctly identify the age of the child, and that you can use using like your calendars and things like that. So if the mother does not remember the exact date of the child, then you have to relate that to that, was there some famous or very prominent festival nearby. Okay, so you can actually assess that what will be the age of the child. But whenever we are assessing any of the anthropometric measure, it is very important to note down the age of the child accurately, because according to this age only you will be relating weight and height and most of your anthropometric measurements. So now when I talk about these all things, whatever we have learned, we will be discussing now one by one all these, right? So first one is what? Height for age, right? So as I told you that height is a total increase in your length, right? So this height for age is related to what? That at this particular age, child's height should be this much, right? And if it is not so, for example, this child is 3-year-old and his or height should be say 80 centimeter, just an example, and the height of the child here is only 60 centimeters. So obviously we know that there is something wrong with the child. The child's height should be 80, but at present it is only 60, right? So that depicts what? That depicts low height for age. That means according to age of the child, the height of the child is less than what is desired or than what is the reference standard. And please mark this to be important, that whenever we say that it is low height for age, that means at that particular age the height is lesser than what is desirable, then the child is indicative of what? Stunting. Okay, so whenever we read different newspapers or reports of our country, and we say that, say 15% of our kids or children in our community are stunted. So what do we mean by stunting? When the child has low height for age, that means 15% of children in our community have a lower height at that particular age then what is the reference. Okay, so always remember, low height for age is what? It is referred to as stunted. And always remember that whenever we take height and weight, so the difference between height and weight is, or the indicative is what? Weight is an acute indicator and height is a chronic indicator. Can you see here they have written is indicative of stunting and of chronic malnutrition. So always remember that stunting or height is indicative of what? Chronic malnutrition, whereas your weight is an acute indicator. Acute means sudden change in anything will be reflected in your weight. For example, if you have some festival coming up, or you have some party at your home, right? Or there was some wedding season and we tend to eat more, right? So I have consumed much more than the required, right? So first thing which I will notice is what? Weight. Okay, if you have been fasting for a few days, or you are not very careful about your diet, your dietary intake is low because of any of the reasons, you will have a weight loss. Okay, so any acute change in your dietary intake will be first reflected in your weight. But in case of height is chronic indicator. Chronic means long term. So for a longer period of time, if the diet of the child are you know not good, okay, or they are eating less, or quality wise, quantity wise, the diet of the children are not up to the mark, so that will be reflected in their height. So that is why we say that low height for age is indicative of stunting. So low height for age is known as what? Stunting, and that is a chronic malnutrition indicator. How do you measure the height of the child or any individual? So you have to make sure that you are standing straight, you are not wearing shoes, okay, and things like that. But in case of children, when they cannot stand, a 5-month-old baby or a 6-month-old baby who will not be able to stand straight, so in that case what you do is you need to incline the child horizontally, right? You may have to make down or lie down the child, and then you will be measuring his or her length, right? So in that case, in case of children, we usually refer height to length also, okay, because height is something vertical when you are standing up, right? But if a child cannot stand, you are lying him down and then measuring the linear measurement, then it becomes what? It becomes length. So whenever you go through different charts, there is always this indication written height for age or length for age. So why length for age? Because in case of smaller children, they cannot stand, you need to make them lie them, and then you are taking the measurement. So that is not height, that becomes the length. Is this clear, class? Okay, so for measuring the height for adults, we have different things, like you can use a measuring tape, you can use stadiometers. And in case of children, when you are making them lie down and you are measuring the linear or taking the linear measurement, that is known as infantometer. Infantometer means infant, that is related to infant, and meter is what? The measure for your length. Okay, so stadiometers are used in case of adults when you can stand and take the height. In case of children, when you have to make them lie and take the measurement, it becomes length, and the instrument is what? Infantometer. Then we are coming on to the other indicator, which is known as what? Weight for age, right? So height for age was what? That at particular age, what should be the height of the child? Weight for age is what? That it is related to total body size, okay? And this is related to what? This is a more sensitive indicator, because let's take an example that for few days the child is not eating food. So you will notice that the child is not gaining weight, or he or she has started to lose the weight, right? On the other hand, if you are overfeeding yourself for a current period time or over a period of time, you will become overweight or obese. So weight for age is a more sensitive indicator, because it is more sensitive to the changes your dietary intake. And low weight for age is known as underweight. Okay, so whenever we see different reports, or someone says that this child is underweight, so what do we mean by underweight? That the child, according to the age of the child, the weight of the child is not appropriate. So like we took an example earlier, that say that this child is 4-year-old and he should weigh 12 kg, but this child is only weighing 8 kg. So we know that at this particular age the child is weighing less than what is required. So low weight for age is known as underweight. So class, is the difference between height for age and weight for age clear to all of you? Stunting, wasting clear to all of you, class? And please, you have to either write it down or let me know that you are understanding. Okay, clear?
Yes, ma.
Okay, so now in these figures, they are showing you that how you can weigh the child. Okay, so these are different equipments. So the most common one in case of adult is this weighing machine, right? But in case of children, like in Indian settings, we have these things also, which are known as salter scales and things like that, which is a bucket type of thing. Okay, and that is attached to the weighing scale. So you make the baby sit in this scale, and then you can note down the value. Okay, now the third thing which we discussed was weight for height. So first was height related to age, second one was what, weight related to age, and now we have what, weight for height. In this, what you are going to do is you are going to assess weight as per the height of the child. So the height of the child is say this centimeter, and this child is weighing this kg. So you have to see that what should be the weight of the child according to his or her height. Okay, and why this is important? Because low weight for height is known as wasting. Okay, so you can please mark that low, so if a height of the child is say 70 centimeters and this child is weighing say 10 kgs, but according to 75 centimeters this child should weigh 12 kgs, right? But as of height, this child is weighing only 10 kg. So this is different from weight for age. In that, what you are going is you are going to assess age of the child, and according to age of the child you are seeing that what should be the weight. Similarly, when I was talking about height for age, in that case what you are going to do is at that particular age what should be the height of the child. But the third indicator is what, weight for height. So according to height, what should be the weight? And if a child is weighing low height for age, that means according to his or her height, her or his weight is less, okay, as per the height, then this is known as what, wasting. So remember, underweight, stunting and wasting. Underweight is low weight for age, stunting is low height for age, and wasting is what, low weight for height. Okay, now, the fourth indicator in the anthropometric, which we discussed, was what, mid upper arm circumference. Okay, so normally this mid upper arm circumference is taken up till the age of 5 years, right? And how you actually do is, as I told you, that you have to locate the midpoint. So you have to locate the midpoint of the elbow point and shoulder point. Okay, so locate the shoulder point and the midpoint, and then at the mid of that you use a tape, which is also known as tricolor arm tape. Why tricolor? Tri means three, right? So three color tape. So that tape is very important. You can see in this case, right? So you can see this is the mid, right? So mid of the shoulder point, mid of the elbow point, and here is the point where you're going to take the circumference of the arm. Now, this particular tape is a tricolor tape. Why? Because this tape has three colors. So this is not very well bound here. You can see here, right? So this is the tricolor tape. I'll just zoom out so I can make you see. On extreme, right hand side, you can see this tricolor tape. So this tricolor tape has three colors: green, yellow, and red. Okay, so whenever I am taking the measurement, if the measurement comes on green part, okay, so that means the child is normal. Okay, because here this is the cutoff of mid circumference. I will discuss that. Okay, if it comes on yellow part, that means the child is at risk of developing some problem, and red means a danger zone. Okay, so this is a tricolor tape which we use for assessing the mid upper arm circumference of the child. So whenever we say that the arm circumference is less than 12.5 centimeter, so less than 12.5 centimeter will be somewhere in this red zone. Okay, so that means the child is having an arm circumference of less than 12.5 centimeter, and that indicates severe malnutrition. Okay, if your measurement comes in this yellow zone, okay, so that is what, that is between 12.5 and 13.5, that indicates that the child is having moderate malnutrition. Okay, so any child who has arm circumference of greater than 13.5 centimeter will come on this green zone. Okay, and that means the child is normal. His or her nutritional assessment will depict what, that the child is growing normally. Okay, so this was your MUAC, that is mid upper arm circumference. So are these four things clear to all of you? Is this clear, class?
Yes.
Okay. So right now we were doing what? We were doing four methods of nutritional assessment. These were what? A, B, C, D. A was anthropometry, that is related to your body measurements. And in body measurements, we did four different types: weight for height, height for age, weight for age, and last one is what? Arm circumference. Okay, then they have discussed that there are also other measurements which you can use depending upon what is your target population. Okay, whose nutritional status you want to assess. So in case of children, we have other things also, like the head circumference, which is basically related to your brain size, chest circumference. Okay, so usually you will see that when the child is born, okay, so you will be seeing that the head circumference of the child is more than the chest circumference. When a newborn baby you see, so you will be seeing that the head circumference of the child is much larger than the chest circumference. But as the baby will grow in, you will be seeing that the head and chest circumference become about the same, and then later on you will be seeing that the chest grow more rapidly in comparison to the skull. Okay, or in comparison to the head. So these circumferences are also indicative of what thing? These are also indicative that how is the nutritional status of the child. So once the head circumference or the chest circumference were almost similar, or head circumference is a little larger than chest, but later on what will happen is the chest circumference will increase in comparison to the head. So these are also different measurements, bodily measurements, that will help you in assessing the nutritional status. Then obviously you have skin fold thickness. So this particular measurements you do for measuring what? Subcutaneous fat. Okay, so whenever you are using the equipment uses like calipers. So this is a caliper type of thing, and you basically pick up the skin. Okay, and what you are going to do is you are actually measuring that what is the subcutaneous fat. So that means what is the amount of fat beneath or under your skin, and therefore this is known as what? Skin fold thickness. So it is an index that what are the total fat reserves in your body. So someone who is having higher skin fold measurement will have high fat content in comparison to the other one who is having lower intake. So they have given you this particular table. So this is a very simple thing. So as I discussed that you weight and height are the most important anthropometric indicators, anthropometric measures. And using this weight and height, we can assess the nutritional status of the child depending upon what indicator you're using. So you can use weight for age, height for age, weight for height, arm circumference for age. And in case of children, the other important ones are related to chest circumference, head circumference, and also skin fold thickness. So this was your first method, that is anthropometry. So any doubts in the anthropometry one? Anything you want me to repeat? Anthropometry is clear to all of you? Can I move ahead with the next one? Okay. So A, B, C, D. In A, B, C, D, we have done A, that is anthropometry. Now I will be doing C first, that is clinical. Okay. Now, when we were doing different deficiency diseases like PEM. So if you remember, PEM had two forms, no, kwashiorkor and marasmus. Okay. Or when we were talking about vitamin A deficiency, or when we were talking about, iron deficiency. So at that time, what we did was, we knew that deficiency symptom of this particular nutrient, right? So if you are having a lower intake of iron or lower intake of vitamin A and so on, so we learned about what that these lower intakes or these deficiencies causes certain sign and symptoms. So if you do my clinical assessment and you see that I am very pale, okay, so that is indicative that maybe my hemoglobin level is low. Okay, why? Because I'm consuming less of iron in my diet, right? Or if you see a child who is having edema, moon face, right? So that is indicative of what? That is indicative that child is having PEM. And what form of PEM? Kwashiorkor. So that is your next method of assessment, wherein what you can do is you can clinically examine the person, right? So from head to toe you clinically examine the person. Whenever you go to a physician also, initially he does a clinical assessment. He will check your eyes, tongue, etc., right? So that is what? That is clinical. From head to toe you can just clinically assess or see the person. And why? Because you want to look in for that, are there any sign and symptoms related to particular deficiency. Okay, so this involves looking for changes which are known as what? Sign and symptoms. So if there is a bite or spot, that is indicative of vitamin A deficiency. If you have spoon shaped nails, cracked nails, your skin color is very pale, eye is very pale, so that is indicative of iron deficiency anemia, right? And so on. Now the only problem is in case of clinical, so they have given, see, different sign and symptoms which are related to areas of examination, right? So see, if you have mottled enamel, okay, or bleeding gums, so that is indicative of vitamin C deficiency. So they have in this table given you different sign and symptoms and what are they related with, right? Now the only problem in clinical assessment is what? That sometimes clinical sign and symptoms overlap. So there might be one common sign and symptom which might be there because of iron deficiency also, and let's say some vitamin B deficiency also. So you are able to make a judgment that yes, this particular there is some sign and symptom which can be seen, but you are not sure that this is because of what deficiency. So this is the only problem in clinical method. Otherwise it is the most easiest method. You just have to look the person from head and toe, locate the sign and symptoms, and you will be able to do the nutritional assessment. But the thing is what? That when you are making this assessment, you should be trained enough. Okay, so you should be very aware of different sign and symptoms yourself, and then only you can make the correct judgment. But the other problem with clinical sign is what? That sometimes few of the clinical sign and symptoms may overlap between nutrients. So this is the thing. So this was C, that is clinical. Then when I talk about biochemical, that is B. So biochemical is what? Most of us would have done our, say, hemoglobin levels tested. Okay. Or in day-to-day life, you must have looked into some, lipid profiles or cholesterol levels or maybe blood glucose levels. So, whenever you are measuring the essential constituents, like you are measuring or doing the analysis of your body fluids, so that can be related to different blood tests, or you are assessing the urine samples, so that is all related to what? That is related to biochemical assessment. Now, when I compare biochemical assessment with other methods of nutritional assessment, that is anthropometry, clinical, and dietary, okay, biochemical are the most accurate ones and they are confirmatory. Okay, so let's see that from few days my iron intake is low, and if I'm a person who is getting these blood levels or the parameters checked on a regular level, in next report I will get to know that my hemoglobin levels have fallen off, right? And this is an accurate thing. Whenever we go to a doctor or a physician, he might tell us that oh, I see that according to your clinical sign and symptoms, I can see that maybe your hemoglobin level is low. but that is what clinical assessment, and that is only an indication. But to confirm that, he always asks us to get, this blood test done or this urine sample analyzed, right? Why? Because biochemical tests are the more accurate one, and they are the confirmatory ones. Okay. And also, clinical signs and symptoms take time to emerge out. So, if from today my diet is low in iron, it is not that tomorrow you will see paleness in my skin. Okay, or my nails will become brittle and spoon shaped. Because when I talk about clinical signs and symptoms, they take time to appear. So, let's say in another month or so, I might be exhibiting, or I might start to show certain deficiency diseases. But till that time when I can clinically see the visible sign of the deficiency would be extreme. But if I'm a person who is regularly getting my health checkup done and things like that, it will come very accurately in your biochemical assessment. But the problem with biochemical assessment, because for each of the method you should know that what are the advantages and disadvantages. So when I talk about biochemical assessment, the problem is what? Firstly, they require a trained physician. You and I cannot go and fetch out the blood of someone, right? Or I cannot analyze blood and urine samples. So for that, we need, people who are very well trained in that, okay, who will be helping you out with taking out the blood and taking urine samples and then doing the analysis and things like that. So for that, I need proper laboratory facilities wherein I can do the, checking and assessment of these samples. And then also, I need to have, a system. Let's say that I am going to some area where there is no laboratory facility available. So I will be taking that lab staff with me. Okay. So let's say, that is also done. I am taking this lab staff with me who will be taking out blood and urine samples and everything. But then, during that course of time, I have to see that how I'm going to transport these samples. Okay. So from the area where I have taken these blood samples and urine samples of my population, I have to carry them back to the laboratory where analysis has to be done. So, there are many things which are related to biochemical assessments. And other thing is what? That they are expensive, right? So if I'm talking about anthropometry, I need to just have a measuring tape or, some weighing scale and, something to measure the height, and I will be able to depict the nutritional status, right? Similarly, if I'm talking about clinical sign and symptoms, that will not owe me any money. I need to have practice. And if I am good at doing that, I just need to look at the sign and symptoms and I will be able to do the nutritional assessment. Biochemical, though these are the most accurate one, but the problem is what? That they are expensive one. A simple test might cost me money. So this is the problem with biochemical. Then the last is what? Diet survey. So whenever we are talking about nutrition, because we are here to study nutrition, out of all these methods, you should be very well trained at what? Diet survey. Okay. So in this case, what you are going is you are going to assess the food supply or food consumption at maybe individual level or at a population level. So whenever you are doing the dietary assessment, you are assessing the food intake. That might be at your personal level, at your family level, at your country level, or whatever, right? So that all will come under dietary surveys. So in this chart, they have given you different methods of dietary surveys, right? So first one is related to what? Agricultural data balance sheet, which is commonly known as FBS or food balance sheet. Okay. So basically, this particular dietary assessment is done at a national level. Okay. So every nation, every country will have its own food balance sheet. So what is this food balance sheet? This is related to that, at country level. Okay. So maybe this is Africa, India, America, whatever, right? So at my country level, what is the total production that is taking place? So what is my total agricultural produce? To which I am adding that what I have imported from other countries, what I have exported, what are the waste. So, my out of my agricultural products, 3% or 5% is, wasted in transportation or maybe due to bad weather conditions or poor storage conditions, whatever, right? And that I need to estimate by my population. Okay. So that gives me a rough picture that what is the consumption level of different food items or food groups at a national level. So this is the only thing which is at a country level. Then we have different methods at individual level also. Okay. Or family level. So the first one is what? Weight meant method. Okay. So as the name suggests, weight meant, you have to weight. Okay. So actually what happens is that in this case, you will be going to uh, let's say home of that person, right? So you have to visit the house of that person on the day of analysis, and what you are going to do is you are going to obtain the dietary data, dietary intake data. So in this case you will be measuring every possible thing that person is ingesting. So he or she might be having a cup of milk or tea or coffee, or he or she had a sandwich or some porridge, rice, whatever. So you are going to weigh accurately that what is the amount that is consumed by that particular individual. To that you will be also keeping a record that what is wasted. So maybe I had one plate of rice with some fruit or something like that, and I had consumed only half, and half I didn't consume it. So you have to keep a record that what was the plate waste. Okay, so what is the total amount which is not eaten by the subject, and what he or she has consumed throughout that particular day. So this is known as weight meant method. Okay, this is also a very accurate method, but the problem is that nobody will like that you are sitting on my head when I'm eating, right? So I'm eating and you are measuring each and everything, you will make me uncomfortable. Okay, then you have food record or diary. So in this case also you ask a person to keep a written record. In that case I am a person, so I will be keeping my written record of all the food, beverages, or whatever things I have consumed over a period of time. Diet history is basically related to, depending upon that, what months or what is the total duration you want to cover in. So basically it can range back from a week to some few months to a year. So that is a more detailed version. I want to know that in past 6 months what is your diet history. Okay, so and that this is basically done if a person is having some eating disorders, or some he or she has to lose weight, and you have to see that what are the triggers, what what is the different food consumption, or what are the foods which a person cannot able to resist. So this is a very good method. But the two most commonly used method which we use, okay, as a nutritionist, as a people who know nutrition, are what? 24-hour dietary recall and food frequency. Okay, so and in details also they have discussed this 24-hour dietary recall. So as the name suggests, 24-hour recall. Okay, recall means you have to tell me. So if I am taking your recall, what I will be asking you, that you start from yesterday. So yesterday, and this is a retrospective method. Retrospective matlab means that you have already eaten that thing, right? And you are just making a note. So if I am taking any one of yours 24 right to recall, I would be asking you what, that since morning, what are the different food items which you have consumed in. Okay, so I will be asking you to make a note and let me know that first meal what you had. So you told me that you had a cup of tea or a coffee and you had some cookies. Okay, then in breakfast maybe you had some fried egg or some boiled egg, along with that you had some bread slice, and then you had porridge. So you have to make a record for past 24 hours whatever that person has eaten. Okay, and you have to keep a record regarding quantities. Okay, so I ate rice 1 plate, I had 1 apple. Okay, I had a cup of tea, I had 2 slices of bread, or maybe 1 slice of cake, or maybe 1 glass of some coke or something like that. So you have to keep a very very detailed check, starting from the first meal of the day till the last, and then you will be doing the nutrient analysis. So I consumed 2 slices of bread, what calorie, what carbohydrate, what are the nutrients I consumed in. So usually this 24-hour dietary recall is done for 3 days. Okay, so usually we do this for what, 3 days. But this 3 days should include 2 day working and 1 day non-working. Okay, or a holiday. Why? Because most of us have a different consumption pattern on holidays. Like on Saturday and Sunday most of us are not working, so our eating pattern is very different, right? And maybe when I am on my job, or I have to go to work from Monday to Friday, my eating pattern is different. So we do not want to have any bias in that relation. So that is why we usually take 24-hour dietary call for how many days? 3 days. which includes 2 days working and 1 holiday. Okay, if you have a bigger sample size, say I have to take 24 right to recall for 1,000 people or so, you can also do it for 2 days just for your ease, but again that has to be 1 working day and 1 holiday. So this is your 24-hour dietary recall. Now usually this 24 hour dietary recall is also, uh, taken care of by another thing which is known as food frequency questionnaire, this one. Okay, so in this it is nothing, in this it is like a checklist. Okay, so let's say that in checklist I have mentioned milk and milk products. So what are different types of milk and milk products I will be mentioning. So let's say milk. Okay, or you have some cottage cheese or different type of cheese or yogurt, curd, etc. And then what we need to see is, or green leafy vegetables in which you have fenugreek or mustard leaves or spinach and things like that. So what here we are doing is, we are just assessing that what is our frequency pattern of that particular food item. So if I talk about milk and milk products, maybe milk I'm consuming on daily basis. Okay, so maybe I'm consuming, let's say, 350 ml of milk on daily basis. That includes consumption of milk in the form of milk as it is, and also some amount of milk which I'm using in my tea and coffee. Okay, then if you ask me yogurt or curd, so that I am eating only twice a week. Okay, and if you talk about cheese, so maybe I'm eating that maybe in 15 days, once in 15 days or once a week. So here what we are concerned is that what is our frequency pattern of that particular food item. Okay, and you can relate that to 24-hour dietary recall. So let's take an example that I took one of yours 24-hour dietary recall, and by that 24-hour dietary recall I came to know that yesterday you didn't had any you didn't have any intake of green leafy vegetable. Okay, that doesn't mean that you don't eat green leafy vegetable. Why? Because if you're asking me, you're taking my recall for yesterday, right? So might be that I have not consumed green leafy vegetable on that particular day when you took my 24-hour dietary recall, right? Why? Because my consumption pattern says that I consume green leafy vegetables only twice a week. Okay, so that is from where I came to know, from food frequency questionnaire. So you can always use 24 right to recall and FFQ together to increase the validity. Okay, so I will come to know that yes, yesterday you didn't had any consumption of 24 green leafy vegetable, because in your food frequency questionnaire you have mentioned that you consume green leafy vegetables maybe twice a week, and that day was not when I took your recall. Okay, so that is why usually in the field of nutrition and public health, 24 dietary recall and FFQ are taken up together. Okay, so these were your nutritional assessment methods. So I'll just go again on the first page of your unit. Just give me a second. So in this we started off with what is the nutritional just give me a second. Yeah, so what is nutritional status? Okay, so that is the state of health which is influenced by your intake and utilization. How you're going to do the nutritional status assessment is by simple technique which is known as ABCD. A stands for anthropometry, B stands for biochemical, C is clinical, and D is dietary. And for all these four we have done some of the advantages and disadvantages related to the same. So now anything you want me to repeat, discuss, you're most welcome. Else I'll go on to the next topic. So please let me know if it is clear or you want to discuss or add on anything. Anything, class?
Yes, ma'am.
Clear? Yeah.
Okay. Can you emphasize on the anthropometry assessment?
Yeah, sure. See, anthropometry assessment, okay, anthropometry stands for your body measurements. Okay, so what do we mean by body measurements? If I ask you to measure your height or measure your weight, okay, so that is what? That is anthropometry. So if I get a child and I ask you that please let me know that what is the nutritional status of this child. Okay, so the one of the most common thing is what? Anthropometry. So what are you going to do is, maybe you're going to take the weight for that particular child, or you are noting the height of the child. So you're either assessing height, weight, waist circumference, head circumference. So whenever you are dealing with circumferences, measurements of your different body circumferences or body parts, that is related to anthropometry. Is this clear now?
Yes, ma.
Okay. And obviously when I'm talking about height and weight, so independently height and weight will not tell me anything. Okay, so I need to relate height with age, so that becomes height for age. I need to relate weight with age, so that becomes weight for age. When I am relating height and weight together, that is weight for height. So low weight for age is underweight. That means according to age of the child, the weight of the child is less, so you will be terming that as to be what? Underweight. When the height of the child is lower than the height, that becomes what? That becomes stunting. Okay, and whenever we see that there is low weight for height, that means according to your height your weight is less, that is known as wasting. So this is your anthropometry. Biochemical is related to all your biochemical tests. So whenever you are going for, different testings related to your blood samples, urine samples, etc., that is our biochemical. Clinical means by clinically assessing from head to toe, you are just looking at the different sign and symptoms, and then, commenting on the nutritional status. And last is what? Diet. So by diet I means you are assessing the dietary intake of an individual or in population, and you can use this by different methods. So at individual level, the most commonly used two methods are what? 24-hour dietary recall and food frequency questionnaire. So this is your ABCD analysis. So anyone else who has any problems, or you want me to repeat or discuss, or is it clear? Is it clear now, class? Ajuna, Helen, Abdul,
Yes.
Lauren, is it clear? Okay. Now next, we are moving on to the next section, that is related to growth monitoring. Just give me a second, I'll come on to that page. Yeah. So can you see this? Now, yeah, now we know that, what do we mean by nutritional status? Okay, we know that what are the different methods of assessing this nutritional status, and this is something which is related to growth monitoring, which is your next, subsection, and this is also very important from your examination point of view. So when I say growth monitoring, right, so in simplest term it means what? Monitoring the growth. Okay, and this growth monitoring is very important in case of children, right, because they have to grow. Now when I say growth monitoring, so obviously by growth, if I am saying this child is growing normally, or the growth of the child is good, so you can relate that to what? That this child is increasing in size. So this increase in size can be either in weight, okay, or even in height. Okay, so whenever we see any increment in the size, we say that there is growth which is taking place. And when I am monitoring it, monitoring means I am keeping a close check. So first month the baby is weighing 3 kgs, the second month the mother bought the child and now he weighs 3.5 kgs, next month he is weighing 4 kgs. So we can see that there is a gradual increase in the weight of the child. Okay, and we are keeping a close check on the growth of the child in terms of weight on every month basis, right? So this is known as what? To keep a close check. So growth monitoring means to assess that there is regular increase in the size of the living being, a child in this case, and you are keeping a close check on that. Why? Because let's say this example, that last month the mother came with the child, okay, and this child weighed 3 kgs, right? This month the mother came and the child is weighing 2.5 kgs. Let's say next month she will be coming, the child is again weighing 2.5 kgs. So you can make out that this child is not gaining weight. Okay, once it was 3 kgs, and now for past 2-3 months what is happening? The weight of the child is 2.5 kg. So you can see that there is something wrong. The growth of the child is slow, or it has stopped, and that is what is known as growth faltering. Can you see this term, growth faltering? Okay, I'll type in the chat box also. So what is growth faltering? Growth faltering, just give me a second. Yeah. So growth faltering is related to what? Falter. Growth falter.
Related to what, ma?
Huh?
Related to what you said.
Growth faltering. Yeah, I'll
Okay,
repeat.
ma.
So whenever, yeah. So growth faltering means what? Growth faltering means that there is something wrong with the growth of the child. Okay. So maybe he or she is not gaining weight. And if you have not, kept a close check on that, maybe the child will start to lose weight. So growth faltering means what? Whenever there is any negative deviation from the normal. Okay. So normally this child should weigh 4 kgs. This month the child came, he's weighing 3.5 kg. The next month also the child was 3.5 kg. Third month also the child was 3.5 kg. So you have to keep a close check. Now you know that for past 3-4 months this child is not gaining weight. And if you have not kept a close check, or you have not intervened properly, you do not come up with proper referral services or corrective measure, maybe next month the child has 2.5 kg. So now what is happening is that initially the child was growing, then there was sudden stoppage in the growth of the child. Okay. And then we didn't took enough care of the child, and now what is happening is this child has started to lose weight. Okay. So in that case what is happening is all this is related to growth faltering. Okay. So growth faltering indicates what? That there is something wrong with the child which needs to be detected and corrected. Okay. And obviously how you are going to do is when you are keeping a close check on the growth of the child. So one of the best way, okay, to do the growth monitoring or keep a close check on the baby's growth is what? Taking the weight regularly. Okay. And why weight and not height? Because we know that weight is an acute indicator. On monthly basis, if you are feeding good food to the child is having good dietary intake, that will be depicted in his or her weight. Okay. And height takes time, it is a chronic indicator. So on every monthly basis, if I have to select between height and weight, I will go in for weight. Okay. Because that is a more sensitive indicator, that is a more acute indicator. So one of the important things how you are going to monitor the growth of the child is using a tool which is known as growth charts. Okay. So basically in India we have one of the biggest programs, supplementary feeding programs, which we will be doing, which is by the name of ICDS, that is Integrated Child Development Services. Okay. And one of the major components of this ICDS is related to regularly doing the growth monitoring of the child. Okay. So what we have to do is that all the children are registered under this scheme. So we ask the mothers of these children to visit the centers, whatever ICDS centers are. So we ask the mothers to visit these centers on monthly basis. So every month they will be getting their child, and the workers there, the ICDS workers over there, will be accurately weighing the child. Okay. And they will be plotting a graph. So by this graph plotting, we are going to keep a close check that how this child is growing. Okay. So basically you can see a growth chart is given, this one. So I'll just zoom out so that this chart is clear to you. Okay. So this is a growth chart. So like most of the graphs, so what you can see that there is age on the x-axis, and on the y-axis you have the weight. Okay. So every month you are getting the child and you are making a point that how is the growth of the child. Okay. So I'll just share one more thing with you. Can you see this board? Is this visible to all of you? So let's say that this is the graph. Okay. So here you have the age and here you have the weight, so W, right? So let's say that at this month, okay, at you say 1 month of the age, right, this child had whatever kgs of weight. Okay. So this was 3 kgs. Okay. Then next month the mother bought the child and this was 3.5 kg. Then the next month it was, let's say, 4 kg. So over the period of time what is happening is that when there is increase in the age, obviously child is growing every month, right? Here you can see what? Here you can see that with increase in the age, the child is gaining weight. And when you will be joining these points, right, you will be getting an upward curve. You can see this is a curve, right? So when you will be joining these points, you will get a curve which is known as what? Upward curve. Upward means what? Rising. Okay, so rising curve depicts what? That the growth of the child is good, right? Why? Because here when age is increasing, so with increase in this age, you can see that weight of the child is also increasing. Is this clear? But then maybe what happened was that maybe next month the mother came, okay, and I could not see any increase in the weight of the child. So the point is here. Okay, then mother came again the next month, and again the child did not gain any weight, and this was again here. Okay, so now here you can see that what type of curve this is. This is getting what? Straight. Okay, so this type of curve, or direction of curve, is known as what? Flat curve or straight curve. Because the line has straightened, it is flat. So due to some reason, whatever reason it might be, child is not gaining weight. So you will see a stationary line, a flat line. That is indicative of what? That here it is important for you to come up with some action. Because if you are not taking this thing seriously, then maybe when next month the mother came, this child had 4 kgs here. Let's take an example, and next month this has reduced to say 3.5 kg. Okay, and then you did not come up with any good intervention or good corrective measure. Next month it has reduced to 3 kg. So now what you can see is that child has started to lose weight. Okay, and when you will be joining these point, this is what? Downwards. Okay, so the third curve line is related to what? Downward. So these are the different directions when you plot growth chart. So these are different curve directions which indicate the nutritional status of the child. Okay, so there is an upward curve. So by upward curve I mean what? That whenever the child is gaining weight, so with increase in age the child is also gaining the weight. Then if there is something wrong with the child, so child is increasing in age, no doubt, but his or her weight is stationary. They are not gaining weight. So this type of curve is what? Stationary or flat. And when you don't come up with proper intervention, or there is something severely wrong with the child might start to lose weight, and this is what is known as downward curve. Okay, so is this growth chart plotting clear to all of you? Okay, so this is how they will be doing plotting. Okay, so you have normal. So if any points come above this first line, that means the child is growing normally. If this comes between this first and second line, that means the child is suffering from grade 1 malnutrition, and so on. Okay, so this is your growth chart, and in India we use weight for age growth chart, and particularly this is one of the most common component which we use as ICDS. Okay, so you can see that they have mentioned different steps in growth monitoring. So first one is correct age of the child, because this is weight for age chart. So obviously you need to know the age of the child. Then you are going to accurately weigh the child every time he or she comes for the measurement. You are going to accurately plot the weight indicator as in the graph, and then you have to interpret the direction of the growth curve. Okay, so what direction of the growth curve, which we discussed. Okay, so see, they are explaining you that how you can do the growth plotting. So you can see they are joining different points over the period of so as to get a growth curve, and these are the three interpretation which I discussed right now. Okay, so this first one is the upward curve, you can see here. Okay, then you have the flat curve or stationary. That means the child is not here, you can see a stationary line. And then if you are not taking proper attention, what is happening is this child has started to lose weight. So this is what? This is a downward curve. Okay, so you should know all these three curve directions. So is this clear to everyone? And obviously if you come to know that this child is not gaining weight, or child has started to lose weight, you have to take appropriate action. So what appropriate action? You will be making a analysis, doing coming up with an intervention and doing the follow up. So you would be suggesting different, medical interventions, like, proper immunization of the child, or, if it is related to some infection. Okay, so you would be recommending different, antibiotics and things like that. If it is diarrhea, you would be asking mother to have, ORT, that is oral rehydration therapy, which can be done by giving oral rehydration solution, that is ORS, to the child. Okay, or you would be coming up with some dietary intervention, that, that child is not eating properly, so you would be suggesting different, food items, food groups, by which you can actually increase the quantity and quality of the different food groups in the child's diet. So this was growth monitoring. So anything you want me to discuss again in growth monitoring, or is this clear? Growth charts are clear to you?
No, ma.
What you want me to repeat? Batao, tell me what is not clear
Gross
to you.
chart. Gross chart.
Yeah, so I'll just explain you again. See, growth chart. See, this is a growth chart. So you can go on to WHO, World Health Organization page also. You will get the same chart. Okay. So growth chart is nothing. This is growth chart, which you can see on your screen. Okay. So what is this? This is nothing. On x-axis, you can see that there is age. You can see here 1 year, 2 year, 3 year, right? And you have different columns to that, because 1 year has 12 months. So you will be having these 12 columns. Okay. Then on the y-axis, you have weight. Okay, so you don't have to do anything every time the mother comes. So in India, we are measuring, the weight of these children on monthly basis. Okay, that is a part of that scheme. So every month this mother is getting child. What I am doing is I am accurately weighing the child. So for every month I will be making a growth plot. Okay, so let's see, this mother has come for first month, and I'm seeing that the weight of the child is 3 kg. So you go there and make a point. Okay, then in the next month the mother is coming, the weight of the child is 4 kg. So over the period of time I will be able to assess that what is the growth of this particular child. Okay, so when I join these different points over a period of time, I come to know that this is an upward curve. So by upward curve I mean what? That the child is gaining weight. If for 2 3 months the child is not gaining weight, the curve will become flat. Okay, and if further you don't pay proper attention to the growth of the child, or the cause of not gaining the weight, the child might start to lose weight. Okay, and because of that, what happens is the curve becomes downward. So these are, three different directions which I discussed in this figure also. Okay, so this is your growth chart. Is this clear?
Yes, ma.
Is this clear to everyone now?
Ma.
Okay. So I'll just take a break of 2 minutes, okay, and I'll come back and we will start with the next unit. So this is the most important unit, which was the last unit, which required, details. So I discussed that, and quickly I will be coming on to the other units. In which I just need to make you aware of regarding that particular scheme, because that will not be valid in your region. These are all the nutrition and health programs which are existing or which are part of Indian scenario. Okay, so let's take a break of just 2 3 minutes and I'll start with the next unit. So I'll stop sharing my screen. Until that, if you have any doubts, you can ask me. So just take a quick break of 2 minutes and I'll be back. Okay. So can we start with the next unit? Okay. So the next unit, I'll just present my screen again. Yes. So the initial units of your block 6 deals with different, programs. Okay. So the first part is related to nutrient deficiency control program, which deals with majorly, three, four programs at, which are very predominantly working in case of Indian scenario that is related to control of certain nutrient deficiencies. Okay. So the first program is what is known as to be National, I'll just zoom in, National Prophylaxis Program for Prevention of Nutritional Blindness. So, when we were doing vitamin A, we read about that, our lower intake of vitamin A or deficiency of vitamin A leads to, symptoms or complaints related to night blindness or other signs and symptoms, which are together known as xerophthalmia. So you must have read through, or you might be aware of things like white dot spot and corneal xerosis, ketomalacia, which we discussed it. So what is done at a national level to reduce the prevalence of vitamin A deficiency? So one of the programs here we have is what is known to be National Prophylaxis Program for Prevention of Nutritional Blindness. So in this case, as a part of this particular program, the target group is, people who are vulnerable. Vulnerable means who are at a risk of developing vitamin A deficiency. So you will see that, children under the age of 5 years, okay, are the target group of this particular program. Because, you will see that vitamin A deficiency is most prominent in case of small children. So that is why this program has target audience to be what? Children from 6 months to 5 years of age. And particularly, these are at risk of developing vitamin A deficiency. So now, what is done in this particular program is that to control the deficiency of vitamin A, children are given, liquid preparation. So this liquid preparation is of vitamin A in oil. Why in oil? Because vitamin A is a fat soluble vitamin. So all your fat soluble vitamins like A, D, E, K, they require fat for their absorption. So whenever we are giving vitamin A to the child in the form of this, supplementation, we are giving that in oil to increase the absorption. So there are different dosage of this vitamin A, which is suspended in oil and given to the child. So that varies. So particularly, every child between the age of 1 to 5 years, they are given 2 lakh international units. So this is unit, like you weigh your weight in kgs, height in centimeters of feet. So similarly, the dosage which is given for vitamin A is what? 2 lakh international units. And these are given every 6 months. Okay. So after every 6 months, the child is given this dosage so as to prevent the deficiency of vitamin A. So this is the first program. The second program is known as to be the National Anemia Control Program. So as the name suggests, anemia, and this anemia can be any of the nutritional anemias, and the major ones are related to deficiency of iron, folic acid, and B12. So in this particular program, your pregnant women, lactating women, okay, or women who are using some sort of family planning measures, and also children of both the genders. So both boys and girls are the major target group for this particular program. Now, what is done in this particular program is like in vitamin A deficiency control program, you are doing what? You are feeding the child vitamin A doses. Okay. Similarly, in this particular program, as a part of strategy, you have to supply iron and folic acid tablets. Okay. Why? Because the most common forms of anemia or the most common factors which lead to anemia in our country are either related to iron deficiency or folic acid deficiency. So as a part of this program strategy, what are we doing is we are supplying iron folic acid, tablets to the population. So whenever I talk about pregnant women or lactating women, we say that they have to consume, these tablets, iron and folic acid tablets, regularly on daily basis, at least for 100 days. Okay, so all pregnant and lactating women receive this tablet, iron and folic acid tablet, which they have to consume one tablet per day for 100 days. Okay, and for children and adolescent girls, the dosage is different. So the same dose is there, but they have to be given once a week. Okay, so that is the main program strategy. Now we have also improvised this particular program, and we have including things like deworming camps and other things which can help in lowering the prevalence of anemia. The third program is what is known as to be iodine prophylaxis program. So we know that goiter in case of adults and cretinism, particularly in case of children, are the effects of iodine deficiency. Okay, so to provide this good amount of iodine in the diet, we have come up with this particular program, which is related to consumption of iodized salt. So this particular program was launched as National Goiter Control Program. Okay, and now this is being called as iodine prophylaxis program. So basically here what happens is that you are distributing fortified salt as a distribution strategy. Okay, so what do I mean by fortified salt? That is your iodized salt. So this salt has iodine added to that, and salt is something which every person will consume in the diet. So in India we have different regions. We have East India, South India, West India, whatever, right? So what is happening is that at every state level or after a few kilometers, our diet changes, right? So the best way to fortify something which could be easily consumed by all of us was salt. Okay, because salt is something which being in any part of the India or any community, I would be using salt as a part of my meal. Okay, and I will be consuming that. So that is why salt was taken as a vehicle to fortify. Why? Because that contains iodine. Nowadays, to combat iron deficiency also, we have double fortified salt. So by double fortified salt, I mean what? Both salt and iron. So the distribution strategy of this particular program is related to provision of buying iodized salt. And actually in India, we have a ban on sale of non-iodized salt. So it is essential for us to make a note that, here in India, we only consume, and the national policy says that I cannot sell non-iodized salt. So these are the three programs which are related to nutrient deficiency. So first one was related to what? Vitamin D deficiency, in which you are doing what? You are feeding the children the vitamin A dosages, which is basically vitamin A supplementation in oil. Okay, so every 6 months, starting from the age of 6 months till 5 years, every 6 months the child is given this as a part of National Nutrition Anemia Control Program. You are providing iron and folic acid tablets to the target audience, which includes pregnant and lactating women, and also children, that includes both boys and girls. And finally, we have iodine control goiter control program, which was related to the supplementation of or fortification of salt with iodine. Okay, so these three are deficiency control programs. So anything you want to ask me in these three programs? Anything which is not clear as a part of these three programs? Clear? So I can go ahead with the next one. Okay. So the next section is related to what is known as supplementation programs. Okay. So I'll share my screen again. So this is the last unit basically, and yeah, so these are the second part of major nutrition programs, but these are known to be supplementary feeding programs. So there are two major programs which come under this category. So first one, which I discussed during this growth monitoring thing, was ICDs. Okay, so that is related to as Integrated Child Development Services, and the next one is what? Midday Meal Program, that is MDM. Now, why these are known as to be supplementary feeding programs was that we here in India have very high rates of malnutrition. Okay, And this malnutrition is highly prevalent, particularly in case of our children. Okay, so we say that majority of our children under the age of 5 years are stunted, wasted, underweight, whatsoever. So why this problem exists? Why our children are underweight, or why we have pregnant women in our country who are anemic and things like that? Because there is something wrong with the diets. Okay, so the common pattern is what, that usually maybe these children are consuming less than what is required. So by less here, I mean both quality and quantity. Okay, so what government here noticed was that there is a gap in what the child is eating or what he or she should eat. Okay, so to narrow down that gap between the intake of the child and recommendation of the child, we came up with different strategies. And two of the biggest programs which exist or which run very efficiently in India are what? ICDS and midday meal. Okay, so we will be discussing one by one these, and these are not to be supplementary. Why? Because in this you are making them eat one healthy snack or recipe. Okay, so whatever this child might be consuming at home, that is a different thing. But as a part of the strategy under ICDS and midday meal program, we are actually feeding the children. Okay, so basically the target group for both these are children, lactating women, and pregnant women, right? So we are making them eat a healthy snack in school or as a part of some scheme wherein we have different centers. So that is why these programs are termed to be what? Supplementary nutrition programs. So the first program is what? ICDS. So ICDS is Integrated Child Development Service Scheme. Okay, so in this you have the different objectives, right? So the main objectives of the ICDs are these, right? So I'll just go through one by one. So one of the most important objectives of ICDS is related to what? That you have to improve the nutritional and health status of children in the age group of 0 to 6 years and also adolescents. Okay, then you have to lay proper foundation which is related to psychological, physical, and social development of the child. You want to reduce the total mortality, morbidity, malnutrition, and school dropout rates. You have to achieve effective coordination between policy makers and implementers. And lastly, you have to enhance the capability of the mother so that she can efficiently look after the health and nutritional requirements of her child. Okay, so all these five are the major objectives of the program. Now, what are the different components of ICDS? So, as a part of the ICDS scheme, we have these major components. So, what does ICDS do? It helps in providing supplementary nutrition, which I told you. So, every child, every adolescent girl and pregnant women who are enrolled in as a part of this particular scheme will actually receive a healthy snack or a recipe on daily basis until unless it is something a national holiday or things like that. Otherwise you provide supplementary nutrition. Then immunization, so children are immunized with certain very important vaccinations like DPT or BCG or polio, etc. So that all immunization is covered as a part of this particular program. Then there are also periodic health checkups and treatment of minor ailments. Minor ailment means maybe some seasonal fever or some cold, cough in case of children. So that can be treated at this level, or it can also provide you with referral services. So if there is something serious which cannot be dealt at this level, so the program will offer a referral services to the next hospital or service center. Then growth monitoring. So this growth monitoring we have already discussed in details in our last section. Okay, so talking about weight for age or growth chart for proper assessment of the growth. Then the next part is related to non-formal preschool education. So, making children learn alphabets or making them learn the basic moralities, things like that. So that is all related to what? Non-formal preschool education. You also provide health and nutrition education to women, particularly in case of pregnancy, lactation, and women who have small babies so that they can take care of the nutritional requirements and health requirements of their families and particularly their children. This program also provides safe drinking water. Okay, so these are all the components of ICDS. So here you can see that this is a pictorial depiction of the different components. For us, the most important one is related to this, that is supplementary nutrition. Okay, so basically all the children up till the age of 6 years, okay, and expectant, that is pregnant and nursing mothers, right? So they are being supplied with a supplementary food. Okay, so a prepared supplementary food is provided to them. And why this is important is because this program, covers the families or the people who are, identified to be poorest. So they cannot afford good meals. Okay, so that is why this program is very important. So basically this program has provision of providing different calories and proteins. Okay? So if you look at the children, this snack provides, these rates are older ones. So basically, these are the older ones. The newer ones are that in case of children also, you provide 500 kilocalories and 12 to 15 grams of protein. Okay, so usually you say that 12 to 15 grams of protein and 500 is the kilocalories which this snack should be providing. So you are making some rice preparation, some wheat preparation, or whatever is common in your area. So this should be providing 500 kilocalories and 12 to 15 grams of protein in case of children. And for adolescent girls who are school dropouts and pregnant and lactating women, the norms are 600 kilocalories and 18 to 20 grams of protein. Okay, so this is done, which is a major component. And part of this program, the amount, because you are cooking food and feeding the people, so a part of this expense is taken care by the government at the central level and some at the state level. Okay, then they have discussed each of the components which we have already discussed. Okay, so please remember that at the part of ICDS there are different components which are done, which we have already discussed it. Okay, but one of the major uh, things that is related to ICDS is provision of supplementary feeding, and that is why this is one of the major programs related to supplementary feeding in India. So is ICDS clear to all of you? Is ICDS clear to all of you? Yes or no, class? You can write in the chat box or unmute yourself. How will I come to know that things are clear to you? So I suppose this to be a yes, that this is clear. Okay. Can I move on to the next program? Okay. So the next program is
Yes,
also
ma'am.
one of the biggest supplementary programs which we have here in India, which is known by the name Midday Meal Program. Okay, and commonly MDM. Okay. Now, the midday meal program is commonly known as the school lunch program or the school meal program. Okay. Now, the basic genesis, the basic fundamental thing which was related to this particular program was that this program aimed at improving the attendance of the school. Okay, so long back here in India, we realized that most of the children are not attending the schools. Okay, and even if they are coming to the school, they belong to those families who cannot afford good meals. Okay, so most of the children who come from these areas or rural areas, they come to school partly hungry, and even some of them may be empty stomach, and they have to come long distances walking to attend that school. So they are not able to concentrate on the studies, and obviously they will not gain any benefit from this education, right? So basically, to combat this particular thing, to improvise their enrollment rates, to decrease their dropout rates, Indian government came up with this particular program. So here the objective of this program was related to what? To improve the nutritional status and attentiveness of the school children. Okay, in your books it is written primary sections, but now this has been upgraded to upper primary. So here in your manuals, if it is 1 to 5 classes, that is great. So now we have 1 to 8 actually. Okay, so it has increased its effectiveness it has increased, widened its target group, not to only primary section but also upper primary. And obviously the second objective was what? That we wanted to improvise on the school enrollment. We wanted more number of children enrolling for the school and coming to formal education and improving their attendance, and also to reduce the dropout rate. So these children are coming from very poorest of the poor families who cannot afford meals of the child. So obviously, what do? They actually are not interested in making their children to go and learn in school. But when we are providing means to that, so this is like a additional thing for them, right? So they will not be interested in sending their children for education, but definitely they know that they will be getting one, good meal there. Okay, so this was the basic fundamental funda behind genesis of this particular program. So now here also, like your ICDS, the children are provided at school fees of school lunch, which comprises of cereal combinations, some amount of vegetables and fruits that has been added, and the seasonal specialities. So here also you will see that the diet of the children are balanced with the total calories and protein intake. Okay, so usually it is around 700 kilocalories depending upon primary or upper primary sections which you are taking. So whatever meals have been provided, you have to follow the nutritional norms. That is what is the amount of calories and proteins that need to be given to the child. Okay, so these were the major components of the midday meal program. Okay, so anything in this in these two programs which you want me to repeat? So the three nutrient deficiency programs were first related to vitamin A deficiency, second related to iron deficiency, and third one which was related to iodine deficiency. Then two of the supplementary nutrition programs which provide supplementary meals to these children are ICDS, that is Integrated Child Development Services, and the next one was what? Midday meal program. Okay. So anything you want me to discuss, you're most welcome.
Excuse me. Can you
Yeah.
pregnancy
Prophylaxis program,
prophylaxis?
which vitamin A. Yeah, okay, yeah.
Yes,
So when I talk
yes,
about
for
the
pregnancies.
national prophylaxis program for the prevention of nutritional blindness, this is what you are asking me to repeat, right? So as a part of strategy to cure vitamin A deficiency, okay, because we know that vitamin A deficiency is related to many of the effects which you can see in your eyes. So by spot or dryness of your cornea, conjunctiva, this is all related to vitamin A deficiency. And once this was one of the highly prevalent diseases, vitamin deficiency diseases, particularly seen in the small children. Okay, so preschool age is related to vitamin A deficiency. So in order to correct that, in order to lower the prevalence, we came up with this particular program. So as a part of the program strategy, in this program, what do we do is we provide vitamin A supplementation. Okay, so this is like a solution which is provided to the children. So vitamin A is given orally in the form of oil dosage. Okay, why do we combine vitamin A with oil? Because vitamin A is a fat soluble vitamin. So if you are adding little oil to that, it will help in its absorption. Okay, so that is why, as a part of strategy of this particular program, we provide vitamin A supplementation. Okay, every 6 months. So starting from the age of 6 months till 5 years, child will be beneficiary of this particular program. So as a part of strategy, every 6 months, this child is given this vitamin A supplementation. Okay, so to do what? In order to prevent or cure the deficiency of vitamin A. So depending upon that, whether you are preventing this vitamin A or you are curing it, the dosage will vary. Okay, so as a part of preventive strategy, you usually give 2 lakh international unit of this vitamin A solution to the children between the ages of 1 and 5 years. Okay, so you will be seeing that by the age of 5 years, this child will be receiving massive dosage of vitamin A supplementation. Okay, so that is why this is this program in which every 6 months you are providing vitamin A supplementation to all the children in India. Okay, so is this clear now, or anything I need to add on? Anything else which is not clear?
Yes, ma'am.
And others also, if there is anything which is not clear, please let me know.
I am not hearing you well
Okay.
because the network is cracking.
Wait, I just yeah. So now, am I audible? Is it better?
Yes,
Yeah.
ma'am.
So anything you want me to repeat? And anything from the
I asked you a question about about prophylaxis, but unfortunately, you give me answer, but the network is cracking. I am not hearing you well.
I'll
That is
repeat
why
it.
I ask you again.
I'll
Can
repeat
you
it.
repeat it,
Yeah, I'll
please?
repeat it. So this is regarding vitamin A you are asking, right? Vitamin A prophylaxis program you want me to discuss again, right?
Yes.
Yeah. So see here in India, we have deficiency of vitamin A, which is very much prevalent, particularly in case of smaller children. Okay. So children who are, 5, 6 years of age, they have very high prevalence of vitamin A deficiency. So to combat this, to decrease the prevalence of vitamin A deficiency, particularly in case of children, we came up with this prophylaxis program. Okay. So as a part of the strategy of this particular program, our target group is children up till the age of 6 years. Okay, so from 6 months to 6 years, we have children who are enrolled under this particular program. And what do we do in this particular program is we want to decrease, or we have to prevent the deficiency of vitamin A in these kids, right? So what we are going to do is that as a part of the strategy of this particular program, we provide vitamin A supplementation. Okay, so a dose of vitamin A is mixed with oil, and that is fed to the child. So why oil based solution is given? Because vitamin A is a fat soluble vitamin. So whenever we talk about any of the fat soluble vitamins like A, D, E, or K, fat will help in increasing its absorption. So that is why in this particular program, vitamin A supplementation in the form of solution along with oil is fed to all the children. Okay, and how do we feed it? We basically feed this vitamin A dosage to the children every 6 months. So starting from the age of 6 months until the age of 6 years, the child is given this dosage every 6 months. So child comes to you at the age of 6 months, you will be providing this dosage. Then 1 year, 1.5 year, 2 years, 2.5 year. So every 6 months you have to provide this vitamin A dosage to the child, because you want to prevent the deficiency of vitamin A. Okay, so this is both preventive strategy and curative strategy. So we have children whom we don't want to be uh, deficient in vitamin A, so we are providing 2 lakh international units of this vitamin A supplementation every 6 months to the children. Is this clear now?
Yes, it is
Okay,
clear.
okay, great. Anything else? Others also, please, if you have anything. So this is, I think, our last counseling session. So anything, any doubts you have from any of the units up till here, you're most welcome.
In our previous class, you have mentioned activity level that influence the nutrient requirement. Please,
Yeah,
can you elaborate this to me?
yeah, sure. So see, whenever I talk about determining the energy requirements, okay, particularly in case of adults, okay, so as an adult, how many calories we need to consume. So these energy requirements are dependent on three factors, right? First factor is BMR, which is known as basal metabolic rate. So your BMR is the biggest contributor for your total energy requirements. So I'll do this also. So whenever I say BMR, so that means that what is the requirement of energy when you are at rest. So whenever I am resting physically, okay, but there are many processes in my body which are being continued, like my heart is beating, okay, there is total exchange of gases taking place, my kidneys filtering. So all these processes keep on working whenever we are at rest also. So this requires energy to be carried, okay. So that is one of the most important contributors for your energy requirement. But the second most important thing is your physical activity, okay. So here we divide physical activity into three categories: sedentary, moderate, or heavy. So if you are a person who has your work profile or your work involves just sitting, like a normal teacher, student, or people who are not doing any of the work manually, there is no hand or feet related activities which you are doing. So that means you will be requiring not that much of kilocalories when you compare with the person who is working as a moderate worker. Like there is a person who is going to gym every day, or he or she is involved in some sports on regular basis. So the calorie requirement will be very different for that person. Then the calorie requirement will be very different for a person who is working as a laborer, say in some agricultural or in some industry or things like that, because there he or she might be involved in rigorous physical activity. So depending upon your physical activity level, your energy requirements are determined. So sedentary will be requiring much lower calories than the moderate, and moderate will be requiring much more lower calories than the heavy worker. So when I compare three physical activity levels, sedentary, moderate, and heavy, heavy requires the highest amount of calories because he or she is involved in work which requires physical activity, which is involving strenuous physical work. And for that, doing that particular type of work, I require more of a calorie. Okay, yeah.
Thank you, ma.
Yeah, sure. Thank you. Anything else, class? Anyone else who wants to discuss anything? You can just flip through your notes. So anything else in any of the units which you want me to discuss again, you're most welcome. I just wanted to confirm that I think in last session I left with one of the diseases. Did I do diabetes with you? I think there was one disease which was left in block 5. Let me check. Yeah, I think heart and blood pressure was left, right?
Yes,
If
ma.
I'm not wrong. Yeah, that was left. So let me just quickly share my screen. I'll do that with you.
Okay, before madam starts,
Yeah.
all of you are completed the assignments or not yet?
We have started, sir.
You already uploaded the assignments or not yet?
Not yet, because we have issue with this ID card. Up to now, I didn't download my ID card. I wrote email to CC Pune. Unfortunately,
Okay.
up to now, no response.
Actually, your query has been forwarded to our headquarters, But if ID card is not there, no issue. You directly upload the assignment, no issue. In your case, no issue. You can directly upload the assignment in the PDF. Okay. You have completed the assignment or not yet?
Not yet.
Not yet. So just write the assignment and upload in a PDF format. Okay. In next section, next session, we will discuss how to upload the assignment. Okay. After this session is end, okay, no issue. But in the next section, beginning, we start see that key how to upload the assignment. Okay. Madam, please continue.
Yeah, thank you, sir. Yeah. So this is last a small unit which I wanted to take up with you. So this is related to dietary management of the diseases, and I think we were left with hypertension. Okay. So when we talk about heart diseases, we have, we know that, basically your heart is related to pumping of blood. Okay. Now there is a very, this figure, which is very, very beautifully given in your manuals. So this actually shows that what are the different changes that occurs when somebody is suffering from coronary heart disease. Okay. Now in figure A, B, C, what you can see is that this white portion is the lumen of your artery. Okay. That is the opening of your artery. Now, why does this heart disease occur is that because, since your childhood, if we are not physically active or we have certain, diet related problems wherein we are consuming more amount of fat, cholesterol and things like that. So what happens is that these actually disrupt or obstruct your lumen. Lumen means opening of your blood vessels. Okay. So here in A part, you can see this white thing. Okay. So this is opening of your uh, blood vessels, say artery. Okay. And then in B, you can see that this has narrowed down. Why? Because these fatty streaks, cholesterol, or, whatever fats we are eating, and that too, headed with low physical activity, will actually block your arteries. Okay. And what will it do? Because through these, blood vessels, your blood moves in. Okay. So when near the heart area, you will see that if this is getting obstructed, then obviously your heart will not be able to get the proper supply of the blood. Okay. And by this, what will happen is that if this continues, this can actually result in complete shutting down of this particular blood vessels. Okay. And this complete shutting of blood vessel will actually take off or stop the oxygenated supply of blood to the heart. Okay. And when this oxygenated supply to the heart is stopped, this is what is known as to be coronary heart failure, or heart attack or heart failure in common terminologies. Okay. So when we talk about the dietary management risk factors related to heart disease, the common one are related to your personal characteristic. Okay. So we say that with advancing age, the risk of developing coronary heart disease increases. Okay. But these are things which are not in your hand. Okay. So these are like, which you cannot control. So you cannot control your age. Obviously you will be aging. Then when we see sex wise or gender wise, we see that men are more at a higher risk of developing CHD in comparison to women. And also people who have family history will have higher chances of developing CHDs than the ones who do not have any type of family history. So if we have family history of heart diseases, like our parents or grandparents have heart related diseases, we must be at a very active level. Okay. Because the family history of heart diseases is one of the prominent risk factors for developing coronary heart disease. Then these are personal characteristics which can act as a risk factor. Then you have learned behavior. So learned behavior means my personal behavior which can result in some sort of distortment. Okay. Like my sedentary lifestyle. So if you are not involving yourself in a good physical activity on daily basis, that can result in certain heart issues. Okay. Then any sort of stress, or if you're smoking, if your diet has high amount of calories, fats and things like that, and if you are obese. So these are certain risk factors. When I talk about dietary management, so these are very individualistic, so these will vary from individual to individual. But all over, what we need to do is we need to modify the total calories in your diet Why? Because most of the people with coronary heart disease, you will see these are either overweight or obese. So the prime objective of any dietary modification in case of heart disease, or people with heart disease, is what? That you have to decrease their total calorie intake so that they can lose some weight, they can achieve their ideal body weight, and this will help in relieving symptoms. Okay, apart from them, you have to keep a very strict check on your fat. Okay, so you have to take into account the quantity of the total fat which you are using. So no visible fat, no cream, butter and other things, no fried snacks, etc. And also the quality. The other important thing that is related is sodium restriction. Okay, because in the next part we are going to study what is known as to be hypertension. Okay, so you will see that hypertension itself is one of the prominent risk factor for developing heart diseases, and most of the people with heart diseases will have raised blood pressure. Okay, and to combat that, to prevent that, to manage that, you have to keep a strong check on your total sodium intake. Okay, next subsection deals with what is known as to be hypertension. So we know that any sort of blood pressure which is higher than the normal is termed as to be hypertension. So there are two values. We have SBP, that is systolic blood pressure, and the diastolic blood pressure. Okay, so systolic one is the 80, that is when the pressure is noted when your heart muscles are contracted. Okay, and when your heart muscles are at a relaxation phase, the pressure that is recorded at that particular time is known as diastolic. So normally your blood pressure should be somewhere less than 120 80. So mm stands for millimeter of mercury. This is the measuring unit of blood pressure. Okay, and here in the figure they have shown you a very traditional handcuff which can be used to assess your blood pressure, which is known as sphygmomanometer. Okay, but nowadays obviously we have other digital machines also which weighs them to be very, very accurately. Now, whenever you have a diastolic blood pressure, which is like 90 to 104, it is termed as to be mild hypertension. And whenever your diastolic blood pressure is between, 105 to 119, you have moderate malnutrition. And if it is above 120, that is indicative of severe hypertension. Now, when I talk about the dietary management, again, here the treatment is related to managing the weight of the person, because again, overweight and obese people are more prone towards hypertension, and you will find that most of your hypertensive adults are obese or overweight. So again, calorie restriction needs to be done so that they can achieve their ideal body weight. And apart from them, the most important thing is that you have to restrict this total sodium intake. So consume less of table salt, because table salt is nothing, it is a formulation which has sodium. Okay, and apart from them, you have to also take into account the hidden sources of sodium in your diet. So it is not only about taking less of salt in the diet, it is also about taking less of foods which are packaged, which are preserved, because all these things tend to have higher amount of sodium. So sodium restriction is the best dietary provision which you can make in for the hypertensive patient. Okay, so this was your heart disease and hypertension, and I think with this we have completed our different sessions for CNCC1. So anything else?
Yes, ma'am.
Yeah.
In your explanation, you have mentioned risk behavior can lead to heart disease.
Yeah.
Can you give me an example, ma'am?
Risk, yeah. So risk factors are certain things which will be putting you at a higher risk of developing heart diseases. So there are certain risk behaviors like age, gender, which you don't have any control on. Okay, because we will have to age. Your gender, that says that men are at a higher risk than women, but then there are also certain personal traits which will be making you at a higher risk than the others. So if you are physically inactive, okay, you do not do any sort of physical activity on regular basis, that is one of the risk factor for developing heart diseases. If you are overweight and obese, if you smoke, okay, or consume excess of alcohol, so these are all the risk factors which will lead to heart disease.
Okay, and also you have mentioned most of those that have heart disease, they may lead to high blood pressure. Can you elaborate that for me?
Basically, see, heart disease and hypertension are interlinked. Okay, so whenever I talk about, patients who are suffering from any sort of heart disease, you will see that majority of them were once having higher blood pressure. So, initially when person comes to you with a complaint of high blood pressure, we usually ask him to her to have a definite control on the blood pressure levels, because uncontrolled blood pressure can lead to heart disease. So that is why, most of heart patients, when they come to you, they will have their raised blood pressure levels, because they are not aware of that, or they do not have a very strict check on their blood pressures. So prolonged blood pressure, high blood pressure, can result in heart disease. And that has to be controlled with total calorie intake, because you want to make your patient to lose some weight, so that he or she is having ideal body weight, he or she is not overweight and obese, and also that is related to total sodium restriction.
Okay, thank you, ma.
Okay. Yeah, anything else?
Thank you, ma.
Okay. Okay, so great. So, sir, that's it.
Yeah, thank you very much, madam.
Yeah, thank you, sir. Thank you so much. So I can disconnect the call? Yeah.
Yes, madam, please.
Yeah. Okay. Okay.
Bye,
Bye, everyone.
bye,
All the
bye,
best.
ma.
Bye-bye.
God bless you.
Goodbye.